movement, and there is drooling one side of the face, drooling, swallowing at night during sleep. What is this condition? How will you know? So always the Rolandic epilepsy always presents at night. So they are saying drooling and swallowing at night. Rolandic epilepsy always they will present at night. The child will come with drooling, with saliva, drooling of saliva, swallowing, facial changes. Some if they're mentioning at night, you have to think about Rolandic epilepsy. Okay.
Yes.
I will explain one by one and then we will. Okay. So what is that? Benign childhood epilepsy or Rolandic? Rolandic always occurs at night. They'll say the child has history of screaming or some abnormal, usually focal seizures at night, like one side of the face, that is drooling of saliva. These are Rolandic seizure. Reflex anoxic seizure means the usually child will be angry at something. Okay. When the mother was not giving him chocolate or he got hit in the head by something, immediately the child will turn pale. That is reflex anoxic seizure, usually seen in like very small age, 2 to 3 years, like that. Complex partial seizure. Complex partial seizure, they'll present with staring, lip smacking, all that thing. Lip smacking will be present. Okay. Infantile spasm usually will present in less than 1 year old. Remember, usually 4 to 8 months, but remember less than 1 year old. Infantile spasm, how they will present? So they'll present with, spasmodic movement, spasm of the hand and feet. Plus infantile spasm is associated with tuberous sclerosis. So they'll present with some hypopigmented patches in the skin. Febrile convulsion means no other history, all neurological examination is normal. Just when the child has fever, that time he undergoes convulsion, but it is well controlled. Okay. Febrile convulsions from 6 months to 6 years. If there is any convulsion during fever, we call it febrile condition, febrile convulsion, provided that there will be no neurological problems. Rigor means rigor occurs if the child is like in really tensed and there is trembling. When you touch the child, he will stop moving. That is rigor. Next one, night terrors. Night terrors and nightmares. There are two types of question. So nightmares, they will be able to remember that I saw this ghost at night and all that. Night terrors, they won't be able to remember at all. So which one they can remember?
Nightmares.
Nightmares. Okay. Absence seizure. How absence seizure will present? Absence seizure, they'll present with going blank at home also as well as in school. That is the difference between absence seizure and daydreaming. Daydreaming will be mostly in school. Absence seizure, they'll go blank for a while, and even if you call them, they won't respond. Okay, that is about absence seizure. Now we learned all this. Now let us move. See, this is benign Rolandic epilepsy. Why? Why Rolandic? Because it is occurring at night. You have to remember the word night. Scenario about toddler got pale and loss of consciousness for seconds after his head was hit by a table with muscle twitching. So this is reflex anoxic seizure. I told you, if they want some chocolate or if they had any ice cream or they got hit in their head, something like that happened, they go pale. They go pale with twitching and consciousness. Toddler, usually when they mention toddler, you have to think of that. Scenario about feverish child, 39 degrees Celsius with abnormal body movement. So fever, he's having fever plus convulsions. What is this condition?
Febrile convulsions.
Febrile condition, no other things. But see, stopped when you touch him. So this line has changed our answer. I told you in case of rigor, when you touch the child, he will stop. When they say about that, that is rigor. But up to this time, up to this line, we were thinking it is febrile convulsion. But when they stop, when you touch them, they will stop. That is rigor. Okay, Dr. Ahlam, anything else you want to ask? Is this clear to you?
Yes.
Okay. 8-year-old child with first attack of convulsion for 5 minutes. Now he's okay. He had history of febrile convulsion when he was 3-year-old. Mother asked if he need anticonvulsant therapy. Ask about the indication of anti-epileptic drug. Does he need? He had only one attack of convulsions. Does he need the medication?
No.
No, ma'am.
First of all, he should be 6 months to 6 years. Febrile convulsion, we do not give anti-epileptic. Okay. Second thing is 8-year-old, he had only one attack of convulsions. Usually, when there is 2 attacks of unprovoked seizures within 24 hours, then we are going to call it epilepsy. Then we will prescribe him the anti-epileptic drug, not before that. All right. So what we will do? Further occurrence of convulsion means we will not give. What is the indication? Now we will not give. If there is further more convulsions, then we will give. That is the indication. Understood? Family history of epilepsy, will you give? No. It's not genetic disorder. Abnormal EEG, no. EEG is not definitive diagnosis for it is not a definitive investigation of epilepsy. Anti-epileptic drug protect against brain damage. No, we will not simply give it. Deterioration of school performance. There should be more frequency of the seizures should increase. Otherwise, we will not give. Seizure, what is the epilepsy? What is the this thing we learned in guideline? If more than 2 unprovoked seizure in less than 24 hours, and if it is frequent, then only we'll go for the anti-epileptic drug. Okay. Case of unilateral facial palsy and can wrinkle his forehead with mild response to steroid. What is mean case of upper motor? Ask about the next step. What will you do? Wrinkle his
MRI.
forehead. Okay. So we are saying that upper half of the face is okay. Unilateral, this full face is affected, but upper half is, he can wrinkle, upper half is okay. That means it is upper motor neuron lesion. If whole part is affected, it is lower motor neuron lesion. So what will you do? You'll do MRI, correct, because it is the upper motor neuron lesion. If it was lower motor neuron lesion, what would you do? Usually will not do anything. Lower motor neuron lesion can occur due to any infection as well. So we'll not go for any kind of investigation. If it is upper motor neuron lesion, then we have to think, okay, there could be some tumor or there could be some brain lesion that is producing this. So we will go for a MRI to check. Okay. So understood this? If there is upper half of the face is okay, only one half of the face is affected, that means this part paralyzes. So this is upper motor neuron lesion. If full part, that means upper and lower half of the face, unilateral, full face is affected, that is
Lower motor.
lower motor neuron. Okay, Dr. Kainal, Dr. Ahlam, you're easy with this?
Yes, doctor. Yes.
Dr. Ahlam, you okay?
Yes.
Okay. Next one is 8 months baby with EEG shows chaotic appearance. Ask about the treatment. What is this case? Tell me. This is a case of infantile spasm. Infantile spasm on EEG shows hips arrhythmia or chaotic appearance like this. It's like a scribbling of a child. You guys remember? During this thing I said, there will be hips arrhythmia, chaotic appearance. That's why they're saying EEG is showing chaotic appearance. He's 8-month-old. So age is less than 1 year. What is the diagnosis? The diagnosis is infantile spasm. So what we'll give? We'll give adrenocorticotropic hormone or vigabatrin. Okay, adrenocorticotropic is not given. See, no steroid is given in option. That's why second line we are choosing vigabatrin. Okay. Now tell me, what is the side effect of vigabatrin?
Visual field.
Yes. What happened to you guys? Why are you guys not answering? Visual field defect. Okay. So vigabatrin, very important side effect is visual field loss. This is very, very important. Frequently they ask